Hello and welcome to Medical Dialogues. I'm Dr. Soni. Here's what I bring to you all from the world of medicine. ESR conference highlights ChatGPT surpassed trainee doctors in assessing complex respiratory illness in children. The chatbot ChatGPT performed better than trainee doctors in assessing complex cases of respiratory disease in areas such as cystic fibrosis, asthma, and chest infection in a study presented at European Respiratory Society Congress in Vienna, Austria. The study also showed that Google's chatbot Bard performed better than trainees in some aspect, and Microsoft's Bing chatbot performed as well as trainees. The research suggests that these large language models could be used to support trainee doctors, nurses, and general practitioners to triage patients more quickly and ease pressure on health services. The study was presented by Dr. Manjith Narayanan, a consultant in paediatric pulmonology at the Royal Hospital for Children and Young People, Edinburgh, and honorary senior clinical lecturer at the University of Edinburgh, UK. He said, large language models like ChatGPT have come into prominence in the last year and a half with the ability to seemingly understand natural language and provide responses that can adequately stimulate a human-like conversation. These tools have several potential applications in medicine. My motivation to carry out this research was to assess how well LLMs are able to assist clinicians in real life. To investigate this, Dr. Narayanan used clinical scenarios that occur frequently in pediatric respiratory medicine. The scenarios were provided by 6 other experts in pediatric respiratory medicine and covered topics like cystic fibrosis, asthma, sleep disorders, breathing, breathlessness, and chest infections. They were all scenarios where there is no obvious diagnosis and where there is no published evidence, guidelines, or expert consensus that point out to specific diagnosis or plan. 10 trainee doctors who had less than 4 months of clinical experience in pediatrics were given an hour where they could use the internet but not any chatbots to solve each scenario with a descriptive answer of 200 to 400 words. Each scenario was also presented to the 3 chatbots. All the responses were scored by 6 pediatric respiratory experts for correctness, comprehensiveness, usefulness, plausibility, and coherence. They were also asked to say whether they thought each response was human or chatbot generated and to give each response an overall score out of 9. Solutions provided by ChatGPT version 3.5 scored an average of 7 out of 9 overall and were believed to be more human-like than responses from the other chatbots. Bard scored an average of 6 out of 9 and was scored as more coherent than trainee doctors, but in other respect was no better or worse than trainee doctors. Being scored an average of 4 out of 9, the same as trainee doctors overall. Experts reliably identified Bing and Bard responses as non-human. Dr. Narayanan said, "Our study is the first, to our knowledge, to test LLMs against trainee doctors in situations that reflect real-life clinical practice. We did this by allowing the trainee doctors to have full access to resources available on the internet as they would in real life. This moves the focus away from testing memory, where there is clear advantage for LLMs. Therefore, this study shows us another way we could be using LLMs and how close we are to regular day-to-day clinical application. We have not directly tested how LLMs would work in patient-facing roles. However, it could be used by triage nurses, trainee doctors, and primary care physicians who are often the first to review a patient." That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.